Hello, I am Dr. Kapiljit Chakravarty. I'm head of the Department of Nephrology in Bankura Shammilani Medical College in Bankura, West Bengal. Uh, I welcome you to today's session. So today we'll be discussing about understanding of CKD and its classical symptoms, what patients should not ignore. So let us start with what is chronic kidney disease. Well, chronic kidney disease affects around 11% of the adult population worldwide, and it affects about 17% of the population in India. It's a long-term condition where the kidneys gradually lose the function gradually and effectively, and they gradually lose their ability to function effectively. According to KDIGO 2024, CKD has been defined as a condition which affects the kidney irreversibly in both its function and its structure, or either which is lasting for more than 3 months and which has got implications on the health of the patient. CKD is actually identified by markers of kidney injury, such as presence of albumin urine, urinary sediment abnormalities, hematuria, blood in urine, electrolyte imbalances, or histological or emerging abnormalities of the kidney, or a history of kidney transplantation, or a decrease in GFR below 60 ml per unit per 1.73 meter square body surface area. An impaired kidney function can have significant effect on the overall health of the patients. To diagnose CKD, healthcare providers use blood test to check GFR and a urine test to check for albumin. Once CKD is diagnosed, the next step is to determine its stage. CKD is basically classified into 5 stages, where the stage 1 is a GFR of 90 or higher. Stage 2 is with GFR between 60 to 89. Stage 3 with a GFR between 45 and 59. And stage 3B with a GFR between 30 and 44. Stage 4 is characterized by a GFR between 15 and 29. And last is stage 5, which is severely impaired kidney function with end-stage renal disease with GFR less than 15. CKD can manifest in various ways, and it's important to recognize the symptoms early. Here are some of the classical symptoms which we encounter in patients with CKD. Fatigue, swelling, especially noticeable in the ankles, feet, or hands, is due to fluid retention. Changes in urination include alteration in frequency or volume, presence of blood in urine, or a foamy urine. Shortness of breath, nausea and vomiting, loss of appetite, muscle cramps, itchy skin. Several factors increase CKD risk, which include diabetes, high blood pressure as primary causes, a family history of kidney disease, aging, obesity leading to diabetes and hypertension, and smoking also elevate risk of damaging blood vessels and kidney function. Early management and identification of these factors are crucial for preventing or slowing the CKD progression. Chronic kidney disease often goes undetected in its early stages due to its asymptomatic nature and non-specific symptoms such as fatigue, swelling, and changes in urination, which can be attributed to conditions or lifestyle factors. The gradual onset of CKD allows patients to adapt to mild symptoms without recognizing their seriousness, contributing to its delayed diagnosis. Lack of awareness about CKD symptoms further hinders early detection and timely intervention. Additionally, CKD symptoms may be masked by other chronic conditions such as diabetes or hypertension, which leads to underdiagnosis until the disease progresses. Chronic kidney disease can lead to serious complications, which include cardiovascular disease, anemia, bone and mineral disorders, electrolyte imbalances, fluid retention, uremic symptoms, increased infection rate, and sleep problems. To manage chronic kidney disease and reduce the risk of complications, here are some of the essential steps that you can take. Regular monitoring. So checking EGFR and albuminuria annually for all patients and more frequently for those at higher risk. Control of blood pressure and blood glucose levels by using appropriate medications and monitoring regularly. Managing anemia and electrolyte imbalances by using erythropoiesis stimulating agents, iron supplements, and dietary modification. Addressing bone health by use of phosphate binders and vitamin supplements. Lifestyle changes by encouraging regular exercise, cessation of smoking, and a balanced diet. Patient education by providing information about CKD management and involving the patients in their care plan. In advanced cases, considering dialysis or kidney transplantation to maintain health and quality of life. According to KDIGO 2024 guidelines, EGFR and albuminuria should be monitored at least annually once CKD is diagnosed. For high-risk patients, these parameters should be checked at least twice a year, and for those at very high risk, monitoring should occur at least 3 times annually. But why is this regular monitoring so essential? Let's find out. Regular symptoms check play a crucial role in CKD management. Here is how. Early detection of progression. Regular symptoms check enable early detection of disease progression. CKD often progresses silently, especially in the early stages when symptoms may not be noticeable. By monitoring symptoms regularly, changes in kidney function can be detected early, allowing for timely intervention and management. Prevention of complications. Monitoring symptoms such as fatigue, swelling, and changes in urination helps healthcare providers identify complications like fluid overload, electrolyte imbalances, and anemia. Early intervention can prevent these complications from worsening. Adjustment of treatment plans. Symptoms like high blood pressure, protein in the urine, and declining kidney function may require adjustments in medications and lifestyle management. Regular symptom checks provide the information needed to tailor treatment plans effectively. Improved quality of life. Managing CKD early and effectively can slow the progression of the disease, reduce symptoms, and improve the overall quality of life of patients. Regular symptom checks help in maintaining optimum health and well-being. Preparation for advanced stages. For individuals at risk of progressing to advanced CKD or end-stage renal disease, regular symptom check can facilitate early preparation for treatment options, such as dialysis or kidney transplantation. Lastly, regular symptom checks play a crucial role in CKD management by enabling early detection, preventing complications, optimizing treatment plans, improving quality of life, empowering patients, and preparing for future care needs. So make sure to stay proactive and work closely with your healthcare team to manage CKD effectively. Thank you.